Hi, good morning, everyone. It's nice to be here today. I'm calling you from Peter Valenzuela's office, and Gary McLeod asked me to give you an update on the vaccines that are coming out. It's been a very busy week. So today is December 16th, and just this morning I gave grand rounds to the hospital. So I'm going to present to you some information about the vaccine, and then we're going to talk a little bit about informational stuff with operations on the vaccine. So as you know, this week, the Pfizer vaccine was recently approved, and then the Moderna vaccine is being presented tomorrow, and we expect approval on that as well. So overall, how are we doing? And I'm going to show you the first graph. The first graph shows you how we're doing up against the world. Everyone is experiencing the second spike. The second peak has been a hammer, as we expected, and it mirrors the 1918 influenza pandemic. However, in France and in Italy and the UK, they're actually locking down their economies and their countries, and their numbers are going down. The US, we're doing terrible at this. So we're the only country in the world that has not locked it down and is doing the worst with the second wave. So we haven't seen the peak yet, not in the nation, and I think not in California as well. So that's kind of how we're doing with the COVID vaccine, with the COVID virus and the pandemic. And we hope to do better soon, and hopefully vaccine will be one strategy, one of many strategies that's going to help us with lowering the incidence of severe infections and hopefully even transmission. So I showed this slide last time, I'll show it to you again. So these are the 5 vaccines currently in the lead in the United States. Now in the very top 2, these are the mRNA vaccines. So the mRNA vaccines recently approved is a Pfizer one, and then also being presented tomorrow to the FDA is a Moderna one. We have the phase 3 data on this, both in efficacy and in side effect profiles. And we know that the Pfizer vaccine is 95% effective after 2 shots, and the Moderna one is 94% effective after 2 vaccine doses. That's extraordinary data. Every year with influenza, the flu vaccine can be 10 to 65, 60% effective at best. And so we now know that this vaccine is really a home run. No one expected this to be that efficacious. Anthony Fauci made a statement months ago hoping for 75%, and he said this was an absolute win. So these 2 vaccine platforms, mRNA vaccine platforms, are very efficacious. And now what we want to make sure is they're safe. And we do have some safety data. The second 2 viruses are the adenoviruses, and we know that the AstraZeneca is about 70% effective. And we don't have data on the Janssen one yet. And at the very bottom, the third red square there is the protein subunit vaccine, Novavax. That will not be available till later next year. So there's a lot of news coming out on the first 2 vaccines, and we really hope to have more information on the other ones as well. We think that Pfizer and Moderna, when they come out with their first wave, they should be available to give 20 million doses right away in the US, and we're hoping for that before the end of the year. So a lot of questions about safety. So everyone wants to know, is the Pfizer vaccine and the Moderna vaccine safe? And what we do know is that you can have some vaccine reactions to them, but I'm going to show you a table of the vaccine side effects. In the Pfizer vaccine, injection site reactions happen at about 85%. Headache, about 50% of people get a headache. Fever, about 14% will get a fever. It seems like fatigue, headache, and myalgias are the most common. Fatigue is the least common of the prominent side effects. Interestingly, just like the Shingrix vaccine, a few people between 0.3 and 1.5% are getting lymphadenopathy. We're also seeing that in the placebo arm, which is kind of interesting. But some people get lymphadenopathy, and then kind of more of a surprise with this vaccine, we've seen some Bell's palsy. There's been 4 cases of Bell's palsy in the vaccine group, in the Pfizer 1.0 and the placebo group. That's 4 out of 38,000 people, so it's very low, but it's something we didn't really expect. The good news about the Bell's palsy is that it recovered within 10 days in all 4 cases, so it was very brief. Now, after the vaccine was released and approved in the UK first, then Canada, now in the United States, the vaccine, there's been 2 and maybe 3 cases of anaphylaxis reactions in Great Britain. All 2 and maybe 3 of those patients actually carried an EpiPen for other reasons. And so people with anaphylactic reactions in the past to food, to bee stings, and to other things might be at a slight increased risk, and the FDA is looking at that right now. So it's not a contraindication to get the vaccine if you had an anaphylactic reaction to something else, but we'd probably watch you for 30 minutes. More to come on that. So there are some take-home points. Let me show you some take-home points. These are take-home points that I gave in the lecture today at Grand Rounds. One is, because this virus was approved under EUA, it's voluntary. So this virus was approved under emergency use authorization, which means that the FDA can pull it at any time. So this gives the FDA power over the vaccine should we see some safety issues. But it also means that the Public Health Department is going to make this voluntary, not mandatory. The side effects of the vaccine are more prominent after the second dose rather than the first dose. And that really represents immune stimulation. It's probably going to feel like a tetanus shot, probably not as bad as a Shingrix vaccine. And when people who are younger have more of a side effect than people who are older, which is kind of as expected. Pregnancy is not a contraindication of this vaccine. So we haven't seen any adverse events in people who have been enrolled in the study and later on during the vaccine trial got pregnant. Pregnancy was actually a reason it was exclusion criteria for the vaccine studies. But a few people still got pregnant during the vaccine trials and there were no adverse events. In fact, the American College of OBGYN, or ACOG, has not only stated it's not a contraindication, they're recommending it, especially for people at high risk like healthcare providers. Now, the vaccine is only made from a piece of RNA. So there's no way this vaccine gets in our DNA. There's no way for this vaccine to replicate. It's just a piece of the mRNA and it can't make whole virus. So there's no possible physical, biologic way you can get COVID-19 from the vaccines, either the Pfizer or the Moderna vaccine. So I want to be super clear about that. And unless you're allergic to part of the preservatives in the vaccine, like pegylated ethylene glycol, there's no contraindications at this point for getting vaccination. And there were some people in the vaccine trials, for example, who were HIV positive and they did great. So far immunosuppression is not a contraindication. It's not a live vaccine. And then the vaccine adverse events reporting system through the CDC is going to be following the Bell's palsy cases and any other anaphylaxis cases that seem very, very rare, but still warrants a closer look and maybe some clarity in the future. So if I showed you the Moderna vaccine, and I'm not going to today, but if I showed you the side effect profile, it mirrors the vaccine side effect profile for the Pfizer vaccine as well. In fact, in the phase 1 study, the Pfizer vaccine seemed to have more side effects than the Moderna vaccine. In the phase 3 study, the Moderna vaccine has slightly higher side effects than the Pfizer vaccine, but they're really almost a match. It's very similar. Half of people are going to get a headache, 2/3 of us are going to feel tired for a day or two, and about 1 in 6 people, or 15%, are going to get a fever. Both of them had a few cases of lymphadenopathy, between 0.6 and 1.1%. And there were 3 and 4 cases of Bell's palsy in each group out of about 40,000 people. So very low risk of Bell's palsy, but not zero. And then lastly, I want to talk about operations. So this is a slide that that Sutter made, but it's not a Sutter strategy. This is a strategy that comes from the CDC. We're going to deliver the vaccine in phases based on availability. Phase 1A is where we are now. We're just starting to see vaccine in the United States. And according to the Human Health Services, the CDC, the Public Health Department, 1A category represents staff who are at risk, healthcare workers and staff at risk of getting COVID-19. For example, you work on a floor with patients, you're in the ER with patients, with direct patient contact, you'll be an at-risk category and fall into 1A. And then also, the health department thinks that the elderly people who are living in SNFs are a tremendous risk for not only severe disease, but also for transmission in that closed setting. So that's the 1A category, that's where we are right now. Then after more vaccine becomes available, we'll be in the 1B category. When more vaccine becomes available, we go into phase 2. That's where we do essential workers, teachers, people who work in grocery stores. And then phase 3 is when the general public has it. We'll probably be into phase 2 by February, and I think phase 3 by March and April. So those are kind of the goals. And so there are some operational stuff going on with this vaccine, and it's been an extraordinary effort at the Sutter level, at the system level, and at the local level as well. So a number of meetings between the pharmacy, between the supply chain, between infection prevention, between employee health. And right now, if you're a clinician, including APCs, you need to go to EHS, Employee Health Services. So you need to go to the EHS website and register. If you don't register, there's no way for Employee Health to track you. Remember, Employee Health doesn't have access to Epic, so they need to rely on this EHS system. And there's been a couple people who have had glitches with that, and we're going to try and send out a training email about how to successfully register on EHS online. And so we should expect vaccine to get to California. Probably it's in LA now, but probably Northern California in the next few days. And we think that Sonoma County is going to probably get 4,800 doses to start, and then more vaccine will be coming out in the days and the weeks to follow. Now, tomorrow the FDA is working on the Moderna vaccine. They're going to review that data, and they're going to very likely approve it tomorrow. And with the Moderna and the Pfizer vaccine, initially, before this year is up, we should see 20 million doses distributed through the health department to the counties, and then finally to acute care settings. And we at Kaiser, we at Sutter have plenty of freezers. So we have the very cold freezers to house and to maintain storage for the Pfizer vaccine. So a lot of information about the vaccine, operationally as well as just informationally. There is some vaccine hesitancy, and I want to give a shout out to Brian Patowski. Brian Patowski is actually starting another campaign called I'm In. That means I'm in for COVID vaccination. And I really want to thank him for doing that. He's going to rally all providers in the community to sign a declaration stating that we're all supportive of this vaccine strategy as well as other ones. And he's already got more than 100 physicians who have signed up, myself included. And I went to sonomacountyvaccines@gmail.com and sent that to Brian, saying that I'm in and I support this vaccine strategy. I think that's going to be a very proactive way for us to support this, not only as a medical group, but also as a community. And thanks to Brian, Smugger's going to be the tip of that spear. So kudos to you, Brian, and I really thank you for that hard work. So thanks everyone for all you're doing. This is a very historic time, and I'm very grateful that we have 2 vaccines coming out that are absolutely wonderfully efficacious and very, very safe in the long term. Thanks so much.